Hello there, it's Lisa Starr with another episode of the StarrCast Podcast. And today's topic, as many are, was inspired by my recent trip to the Global Wellness Summit, which was held in December in Boston. You know, it's usually held in different parts of the world, but we've been confined to the US for the last few years. So in this event in Boston, 3 days of excellent lectures, and because it was in Boston, it really leaned a lot on the local academia and specifically Harvard and lots of smart people and doctors and a lot of talk about women's health. Now, I'm a woman, but I never really thought about women's health as being something separate. But some very wise people showed me that's not really the case. And one of the best lectures we had was from a woman named Carolee Lee, who runs a company called Women's Health Awareness Matters, WHAM. And she has done so much to advance the issues around women's health. She shared some data with us, such as 50% of the workforce are women, half of the workforce, and we control 60% of the wealth. Good for us. We're responsible for 85% of the spending, because who doesn't know that? And 80% of healthcare decisions are made by women. They spend about $300 a month on health and beauty and are 90% of spa visits. And yet, an understudied species. I did not know this, as many people in the audience did not, but the NIH started to include women in studies after an act of Congress mandated it in 1993. That's fairly recently. Before that, all studies were done on men. And it took until 2016 for female mice to be included in research. So Carolee Lee's point was that we end up using data that doesn't even apply to us. And we have our own set of issues, not just the equipment, right? Women work differently and are built differently. They are 2 times as likely to suffer from depression. 80% of women have the autoimmune disorders as opposed to men. 2/3 of women get Alzheimer's. So we need more study and data on what happens to us. And it was no surprise that at the summit, I once again met Judy Mackey. And Judy is joining us today. She is the founder and owner and CEO of the Garden of the Gods Resort and Club in Colorado Springs. And she started the Strata Wellness Clinic, which we're going to hear about. And we are also joined by Dr. Jennifer Habashy, who is a naturopath who works at Strata. So welcome, ladies. Thank you for joining us today.
Good afternoon, Lisa.
Thanks for having us.
So after the summit, I think it was early January, I paid a visit to Strata, and I was so impressed by the facility and the people and so much going on there. It's an incredible facility. And so I sat down with Judy Mackey and asked her, where did this come from? You're not from this world. Like, how did you start this? And I thought Judy could begin by sharing her story with us and how she was inspired to create a wellness business.
Thank you, Lisa. Yes, the story started back in my 20s. At that time, I was diagnosed with a major health chronic illness. And it was a point in my time where I had to make a choice between 2 paths. One was more Western medicine or Eastern medicine. I was really blessed, and I call it my angel, came into my life and introduced me to another type of treatment, which was Eastern medicine. That really changed my life. I was diagnosed with epileptic, and anybody that understands that you have seizures, and the path to go down on more of a Western path was the phenobarbital and dilantin, which would really have changed my life. And I always say I wouldn't be here. But I was introduced to a whole different type of healing, and this healing was Eastern medicine. And in my 20s, this wasn't really even heard of, and I was I was fearful as well. But as my dear friend, my angel said, well, you can go down the path of being on a drug the rest of your life, or you can try something that's non-invasive. And I think that's really what people don't understand with Eastern medicine. It is a really more holistic approach to your healing. But a light turned on. I mean, I felt like all of a sudden I was alive again. And it was just a really beautiful time in my life. And I think anytime anybody has any life event like that, you take it very personal that this is something that a gift was given to you that you need to give back. So this was in my 20s, and I always had that in my gut that this is something that I needed to to really remember and, take it as a life purpose. And it's been with me for a long time.
So, Judy, what kind of therapies were recommended to you on the Eastern medicine regimen?
The first thing, Lisa, was they spent a day listening to me and testing me. I didn't even know what that meant, because at that time you would go in for a quick test and maybe a couple x-rays and spend a few minutes with the doctor, and they give you your diagnosis and a script, prescription, and that was it. They spent time first really talking to me about my life history. And I realized as a child, I had maybe some signals of having issues, but wasn't aware of it. Also really worked on my diet, what I ate on a regular basis, and a lot of blood work. And through that, they identified I was really lacking in vitamin B. I was deficient in vitamin B. At that time, I didn't even know what vitamin B was.
Right.
Like, oh, vitamin B. And also just my diet, in my 20s, you're not thinking of the diet is really important. Women, hormonally, we were dealing with some hormone issues. So really was looking at the whole person.
So you went through this therapy and you felt better, and needless to say. So you were diagnosed with epilepsy, and if I recall correctly, it turned out not to be true.
That's correct. It was just a diet and vitamin B deficiency. I would say within a week, I felt better.
That's amazing.
It was amazing, because I was dealing with this for a couple of years and in denial. And as I mentioned, it felt like a light was turned on. Whenever you're in that mode, and a lot of people can understand that, it's like a heaviness. It's almost like you're not really, it's a cloudiness, and especially if you have migraine headaches or any type of brain fog, there's a heaviness on you. So when this all changed, I could see things differently. I mean, it was just, wow, this is what life is about.
So you were in your early 20s and you decided, okay, I love this. Of course, it was life-changing for you. And you had this idea that you wanted to pursue it, but you put it on the back burner. And what career did you follow at that point?
For the next 20 years, I was in healthcare administration. Mm-hmm. And so I had a couple companies, third-party administrative companies. And what we did is we worked with insurance carriers like Blue Cross Blue Shield, et cetera. But during that time, it seems like God had a plan for me. and I think we all, you get these little doors that open and you decide to take advantage of them. Got into healthcare consulting, and one of my accounts was Cabela's, which I think a lot of people understand Cabela's. And the owners were really focused on their employee culture. And that was the main part of their life, their purpose really, to have this organization. And we were working on more the healthcare costs. And so we were designing benefit plans, and everybody's on a benefit plan, that your health insurance. But they wanted to take it a step further. They wanted to know why their cost was going up. And we identified that really it was people's health. I mean, the reason why we spend more dollars on health is really if somebody has high risk factors, et cetera. And we started at that time, really way back then, a wellness company. And they really wanted to understand and educate their employees on their own personal health. And they're in Nebraska, which is probably the most challenging place to introduce, vegetables and fruits and education on diet. But the owners of the company, the leaders of the company, this was so important to them that they embraced it, and everything was supported for the employees to have access to a different type of care. And that helped me with my journey, because I thought I'm really helping people change lives, because I was changed with my own personal life. So then with that path, started another company called Healthy You, which is employee wellness. So I was still into wellness and a lot of research. At that time, Eastern medicine wasn't on the forefront. So
not at all.
Not at all. And spending a lot of time researching, but also still taking care of my own personal health. And with that, I would have to travel around to find the doctors that I needed to have to keep me healthy. So I was self-managing my care over here in a more holistic approach, still working within a consulting company that I was a partner and then ended up owning a company to educate people, and felt that eventually they were going to have to blend together, because Eastern medicine really wasn't on the forefront, but we would at least talk about diet, which is part of a more holistic approach. At that time, my business partner now, Brenda Smith, which we are the co-owners of Garden of the Gods Resort and Club, we were working on a national project together, focusing on changing healthcare. And she kind of felt like she owed me a favor because I was working on this project dream for her. And she said, "What is your dream?" And I said, "Is to have a wellness center." And so at that time, we came together and kind of put together what the model would look like. And she asked me, "Where would you love to have this wellness center?" And I said, "The Garden of the Gods Resort and Club." I have been a member here since the 80s and just loved it. I mean, when you come on the property, there's just a natural healing here.
Oh, and the views can't be beat, first of all. I mean, it's an amazing place.
It is an amazing place. So we presented this to the current owners at that time. And little did we know the property was for sale.
Oh my gosh.
Yes. So it was like, wow, we were just looking for a space to rent. And then 6 months later, we owned the Garden of the Gods Resort and Club.
So that was a little more than just a wellness center you took on.
Yes, it was a lot more, but it was God-driven and, it was meant to be. And here we are 8 years later. So
you and Brenda had no experience in hospitality, right?
None at all.
And you just find yourselves owning this giant club and hotel. And wow, well, that's a testimony to real woman power. I love that story.
A little bit of risk takers.
So there was no Strata Wellness at that time. When did that open?
When we bought the property, we had to do a refresh. And so we did a major renovation on the property just to bring it up to the level that we felt the experience needed to be a wellness destination. So we always wanted, once we bought the property, we took it from wellness center to wellness destination. We spent about the first 3.5 years just renovating. So about 5 years ago is when the Strata building, the wellness center, was built. But during that time, we did have little beta sites within our on site that we were just testing the waters and testing some of the therapies. But StrataMed did not really get formed about 5 years ago.
Okay. So the building, impressive, beautiful 2-story building, freestanding, but adjacent to the property, like right adjacent. You walk out of fitness, you walk into StrataWell, beautiful lobby. You have all the medical downstairs, the spa and wellness upstairs, and Dr. Habashy will describe more to us, but it's a lovely center and it's for all people. It's not just for women, but there are plenty of women coming there, and you have memberships, which I think is also very fascinating, even at a medical aspect. So when I visited, it seemed very busy and very vibrant, and you have lots of really very skilled practitioners. One of those was Dr. Habashy. So let's bring Dr. Habashy into the conversation. I know that you are a naturopath and you have recently moved to Strata from out of state, correct?
Yes, from Arizona. Quite the difference.
So snowstorms.
yeah, I'm sure the weather is slightly different for you here. So Dr. Habashy, your focus is on what? You have a particular area of focus at StrataWell. Could you describe that to us?
Yeah, so as you said, I am a naturopathic doctor and I specialize in women's wellness. So the nice thing about Strata, which I think is really cool, is that there's actually 2 naturopaths, Dr. Powell, and she focuses more on chronic illness and autoimmune conditions. So it's really nice to see that we have the same foundation, but specialize in different things. So that was something really, really cool that drew me into Strata from the get-go.
Could you describe for our listeners some of the other practitioners who work at StrataWell?
Yeah, so we have a ton of practitioners. I think you had the chance to meet a few of them. So we have 2 chiropractors, one that focuses in structural chiropractics, and one that focuses in functional neurology. Mm-hmm. We also have an acupuncturist. We do IV therapy, energy healing, massage. The spa also has services as well.
And then our medical director is Dr. Mike Barber, which is a cardiologist and an internist. And so he really focuses on the research to make sure that we're doing the research, and he leads the integration between the Western and Eastern medicine, which is critical because we've all become so siloed. And so we're looking at that horizontal where they are really working as a team, as a whole person. So Dr. Mike and Dr. Habashy, they work very closely to make sure that we are looking at the whole person with all the different modalities that we have.
I was able to meet Dr. Barber, and he's just a lovely man and also so well educated as a PhD and an MD, and knows cardiology in and out. So you've got quite a team there. Dr. Habashy, you and I talked about what you do specifically with women and women's health. So perhaps you could describe a little bit about that for us.
Yeah, so I focus a lot on hormones and bioidentical hormone replacement therapy in terms of thyroid health, adrenal health, and sex hormones. And we talked about the difference between bioidentical hormones and synthetic hormones, and that's quite the hot topic right now. So a lot of what I do is educating women on the difference and the importance of going the bioidentical route as opposed to the synthetic route.
Maybe you could elaborate now. What is the difference between bioidentical and synthetic?
Yeah, so as the name suggests, bioidentical, really, like those hormones really mimic our own natural hormones. So whenever we take a bioidentical hormone, whether that be in the form of a cream or a lozenge or an injection, once it's in the body, our body doesn't know the difference between the hormone that we just took and the natural hormone that we create. Mm-hmm. And so absorption is optimal. It's able to bind to the receptor sites in a natural way, and there is very few side effects compared to a synthetic hormone. The molecular structure is a little bit different. So then when we do take it, our body sees it as a threat or something foreign, and it doesn't know what to do with it. And that comes with a host of side effects. Number one being breast cancer, which is why hormone replacement therapy can sometimes get a bad rep, because there is so much research showing that synthetic hormones come with an increased risk of cancer.
So if I'm a woman who's on a hormone, how do I know that I'm on a synthetic or a bioidentical hormone?
Yeah, so if you are getting your prescription from a retail pharmacy like a Walgreens or a CVS, majority of the time it is synthetic. Typically, we have to compound bioidentical hormones from a compounding pharmacy. And that's great because that gives us the ability to really cater the formula and the dosing to your specific needs. So if you're not getting it from a compounding pharmacy, it's most likely synthetic.
So that brings me to the next question, which is, how do you determine what I need so it's bioidentical to me? Because I'm sure it's different for every person. You don't have bioidentical on the shelf that you pull it down, right? Especially if you're compounding. So what's the process of discovery for figuring out what a particular patient needs?
Yeah, so it's a great question. We do a really detailed, thorough lab review at the initial appointment. And we look at a lot of different markers, estradiol, testosterone, FSH, and all those things will give us an idea of how depleted the woman is in some of those hormones. And based on those results, as well as a symptom picture that the patient presents with, we're able to kind of tailor make that prescription and formula specific to each individual.
Dr. Habashy, is it a lengthy process from when I see you until I would receive my specially made bioidentical hormones?
So typically we just need the initial consultation. That can be a little bit lengthy, upwards of an hour to 2 hours, just because we really are doing a very detailed intake and detailed lab review. And after that, once you leave, we're able to determine your dose and pick it up as soon as the pharmacy has it ready for you.
So let's say that I receive a bioidentical hormone, I start taking it. What am I likely to find as a result of taking these?
Yeah, so particularly with women who are in menopause, a lot of times that is associated with a host of vasomotor symptoms like hot flashes, night sweats, sexual dysfunction. So typically those are the first things that we see resolution in almost immediately, which is amazing and one of the main reasons why I love, bioidenticals. Also things such as fatigue, inability to lose weight, hair loss, those are all things that we see resolution in, but sometimes can take a little bit longer just because of how long it took to get there. So sometimes it takes a while to resolve.
So it sounds like these are something that men can take as well.
Absolutely, yes.
And what sorts of issues does it help with men?
So for men, main thing is low libido, any issues with frequent urination at night, inability to gain muscle, fatigue, and even hair loss as well.
Mm-hmm. So do you find that women are very open to this therapy? They're interested in it? Are they coming into Strata because they've heard about it and they want to try it? Or is it something you need to introduce them to?
Yeah, I would say it's about a 50-50 split. So some women come in and they know exactly what they want and they're very familiar and there's not too much education that goes on at our consultation. And there's some women who are a little bit more skeptical and have a lot of questions, which is fine. And, if they choose not to go the hormone route, there's a ton of different things in the naturopathic umbrella that we can do. Botanical medicine, homeopathy, IV therapy. So there's something for everyone.
Judy, I'm thinking about when we were at the Global Wellness Summit and we saw the lecture from Stacey London on menopause, which I thought was quite humorous. And I think there were a lot of men in the audience who were surprised at some of the things they heard.
I agree. And one of the referrals a lot of times are the significant others because they see that their wife is changing. And that's what we think is so beautiful that we can answer some of those questions. So as Dr. Habashy mentioned, is a lot of times they come in for a whole different reason. So we always have everybody put down their goals, but once they get in and we start peeling the onion, a lot of times it gets back to some kind of metabolic or hormonal issue. But it is a beautiful process to watch them, come alive again and be vibrant again. And I think, that's why we have many membership programs, as you know, but women is close to my heart. And I was so happy to be at the Global Wellness when I heard that the theme was about women's wellness, because we are complicated. But just because we are complicated, there is so much opportunity out there to really help us. We respond quickly. And when there's a lot more resources than we realize. So we've developed 3 tracks here just for women, because there is a point. And we feel like the women goes through a different journey, each stage of their life. And, Dr. Habashy really put these together and they're beautiful. One is conscious conception, aging gracefully, and the metabolic management. Even in your 30s, you can have hormonal issues. And sometimes there's infertility with that. And also after birth, after you give birth to a child, your body changes. So really to have a resource, and that's my goal here, is a place that people can come and have, really a holistic approach, but also hope, because they sometimes, we put into this category, this gray area, so we'll just give them a script, antidepressants, as we talked about. And we find out that symptoms, and one thing Dr. Habashy does with Eastern medicine, it's not always on the blood. A lot of times it's symptom-based. And sometimes you think you're just, is this normal? Am I losing it? But those symptoms are powerful indicators of where we can help and intervene. So, I was so excited to see that the focus was on women, because, we need the resources really to stay vibrant, and there's no reason we can't.
Yes, and we know that as we age, all humans, things just don't work as well or feel as well, and you sort of get used to it, and you learn to work around it. And I think that women are people who carry burdens pretty easily. We don't complain too much, but you might realize 10 years later that, boy, I'm just not who I was. And, you want to get that back. And I know for myself, I eat right, I exercise, I get sleep, I do all the things you're supposed to do. I've worked in the wellness industry my whole life, but I'm not 30 anymore, and no amount of my wanting it is going to bring back the physiology that I had then. So, Dr. Habashy, could you elaborate a little bit on those three programs you have? That sounds really interesting.
Yeah, so the three tracks that we have kind of sit under our lifestyle membership that we offer here at Strata. And part of that membership allows the client to participate in all the different therapies we have. And the nice thing about these tracks is that at their initial consultation, we kind of determine what kind of therapies they need. So it's not said like, okay, you get 3 acupuncture sessions, you get 10 massages. We really look at the person and determine what they need and kind of map out how that plan is going to look for them. So the first one being conscious conception. So any woman who's having issues with fertility or who may already be pregnant or even, post-pregnancy, just kind of walking them through that journey and how to combat any issues that they're coming across. Second one is aging gracefully. And this can be anyone from, a person in their menopausal years or a woman who is maybe nearing menopause that just, wants to feel her best. And a lot of times that track will come with more of the hormone therapy. So that's kind of my bread and butter. And then the metabolic management, that really is for anyone struggling with weight management, whether that be weight loss or weight gain, or even just wanting to maintain their weight, just doing metabolic tests and looking at lab work and offering different services individualized for them.
When you hear about these things, I know as a consumer, I think, oh, I should have that. I need a metabolic test. I mean, we don't know how we're doing inside. You only know how you think you feel. So how does a program work? Like if I'm a consumer and I say, oh, I'm interested in this metabolic program, how long does it take for me to feel better and start seeing results?
Yeah, so it's different for everyone. There are some people who feel better within, a couple weeks, and some people it takes a little bit longer. It might take over a year. So our objective really is to, walk them through that process and have options for them. So if one thing doesn't work, we have, 10 different other things that they can try. So a good answer for that would be it really depends on the person. But these tracks are typically a year long.
Oh, a year long. Okay, that's really helpful. So, Dr. Habashy, what's happening in medicine in terms of women's health? Are there conferences now on this topic, or there's more attention on it? How is the medical establishment sort of modernizing in this aspect?
Yeah, and I'm really happy to see that I think women's wellness is being discussed a lot more at conferences, at, even local talks. I think it's becoming something that we're becoming more aware of. Like Judy said earlier, a lot of times, even in the research, or maybe I think maybe you said that in the research, they weren't testing on female mice. And so we really didn't have any information, and pathology just looks so different in women compared to men. And oftentimes that's the reason why certain things are misdiagnosed or underdiagnosed. So I definitely think that that is something that's being talked about more, and trying to do a better job at understanding that.
So what can a woman do who might be listening to this and lives in Tennessee? Can she go to her doctor and say, I need more attention to my women issues? How do you advocate for yourself as a consumer, as a patient?
Yeah, so it can be as simple as that, just saying what your needs are, really finding a practitioner that's going to hear you. And that's why I am a big advocate for naturopathy, not just because I'm a naturopath, but because I'm a patient as well. And I had my own struggles, going the conventional route. And it wasn't until I found a naturopath that really took the time to listen to me and not just look at my blood work and look at my symptoms and throw a pill at me, but really, wanted to get to the root cause, which I think sets apart, allopathic medicine and more Eastern medicine.
Is that what urged you to go on the path to become a naturopath yourself?
It did, yes. And I remember at our talk, we discussed how, I come from a family of conventional doctors, and I'm the only outlier that went the non-traditional route. So yeah, it was just my experiences as a patient, not feeling heard and just feeling really disregarded almost, that led me to want to find something different.
So Judy, from a commercial perspective, what do you see as the opportunity here as women's health and wellness gets more focus in the marketplace?
Well, I think a lot of it is awareness, just making women aware that there is options out there. Our goal with StrataMed is to do more of a franchise, to start helping spread the word, and also coming up with a system that we can let other doctors or to other wellness centers have access to our triage information. So we're really wanting to educate and make awareness. So when you were here, when this building was designed, so the top floor is the spa, the main floor is the wellness center. The lower level is meeting rooms, and those meeting rooms before COVID, I mean, this is all before COVID, we were kind of on our journey, is education and research, and to have retreats here, to have conferences here, so we can either educate physicians or members, people who are looking for answers. So our goal is really spread our knowledge of what we've developed here, so we can make this more available to really women. We just had a lady here that was from Arizona, so I know you feel like you have to maybe be in Colorado Springs, but she came out here from Arizona, and she's been on her own wellness journey, I would say, for probably 10, 15 years. And we had shared with her what we're doing here, and she went through our program. And I was just with her yesterday, and she said, Judy, in 3 months, you changed my life. I've been doing this for at least 15 years.
Wow.
And what it really was, Lisa, was she was self-managing. And I think that's the big thing. Women, we self-manage. I mean,
we think, we go to Google, we look it up, we know what's wrong, right?
Yeah, I mean, that's what we do. We take care of everybody, and we're just gonna, we're kind of the last on the list, but she was doing the same thing. She thought she was going to the best doctors. None of them were really wrong. Problem is, she was self-managing. So everybody was just doing a little bit of what they thought was right. And that's that silo. So we're really looking at the whole person, because by the time she got in to see Dr. Habashy, we probably eliminated a lot of her supplements and what she was on, and just got her really on a clean path, but really focused on her metabolic health. And she was having a little bit of the brain fog. She's in her 60s, a little bit of the brain fog, lack of energy. She wanted to be vibrant again. And it was just beautiful for me to hear yesterday saying, there's only 3 months and look at where I'm at.
That's wonderful.
Those are the stories we love.
Now, you have fitness there. How does that integrate? Dr. Habashy, do you recommend fitness regimens as well as medical ones for patients?
Absolutely. Yeah, and it's very nice to have that convenience factor. You just tell the patient, oh, just down the hall, you can go visit the fitness center. And it's really nice as a practitioner, because I have the ability to talk to the trainers one-on-one about my findings and what the patient is going through, and if I have any suggestions, and really work in collaboration, which is something that not many people have the opportunity to do. So that integration really is key to what makes things so successful here.
I mean, you can almost prescribe strength training or cardio training or, movement therapies, and they're all available in the fitness center.
Absolutely, yeah.
And I'm sorry, go ahead, Lisa.
I was thinking that you have also that great little food emporium with healthy smoothies and snacks, which is just wonderful right at the entrance.
We do have the barista, and that's why with the wellness destination, we want the whole person experience when they arrive on the property, to see the beauty of the land. And also with our culinary team, they're really working on local sourcing, farm to table, working with our dietitian to educate people on the power of food. So we feel like it's a whole experience when you come here. You can come here and just get away and recharge, or you can come and be on your wellness journey, and we can help you with that. So really, as you come to the property, you can select which program you want to be on. We do have executive wellness. We have executives coming here that are burned out. So that's men and women. We work with them a little bit differently. They're more cardiovascular because they're type A and they're just under that stress. but we still put them through a lot of the same program. It's just that the diagnosis might be, or the testing might be more focused on cardiovascular. But so we really try to look at the person, where they're at in their life and what their needs are.
Well, so many things on offer. I mean, from golf and tennis and hiking to IV drips and, the Eastern medicine approaches and the chiropractic, something for everyone. Have you come across any centers in either of your travels that rivals what you offer?
I think what we have here that I've seen is unique is by having the wellness center on property. We've seen where maybe there is a wellness center and then they use a hotel component for them to stay, but to have the whole experience, I have not. The other area that we've found, and we discussed it a little bit, is the silos, even with allopathic medicine and Eastern medicine. Really haven't seen anybody been able to truly integrate, whether it's integrate on philosophy and therapies, but even EMR systems, which is your electronic medical records, on how we track the data. So we feel like we're on the leading edge, and we know we still have a ways to go, but we're really, I think global wellness really helped us to identify we were farther along than we realized, because we've just been plugging away to go after our vision and our dream to transform lives. And so it was really reassuring to be at that conference and realize we're on the right path.
Well, it takes a village, as they say, right? You have your allopathic doctors who believe very strongly in the way they've been trained, and yet you see these great results you're getting with Eastern medicine that's less invasive or less pharmaceutically driven, and you have to respect those results, and it takes open-minded practitioners to do that, which I think that you have that on your property. You have a lot of people who really believe in each other. And Dr. Habashy, you're one of that team. I mean, do you ever feel like in medical settings that you're looked at differently because of your background and training than an allopathic doctor?
No, not at Strata. And that's one thing that I really appreciate, because you're right. Sometimes conventional or allopathic doctors view alternative practitioners as, doing voodoo, or they don't really understand. And that is something that I did personally come across when I was doing my training. But being here, Dr. Barber, who has all these, accolades, and he has, MD, PhD, talks to me the same as he talks to everybody else, and really believes in, the medicine that I practice. And I think that's, important for the integrative setting, but also important for me as a provider to feel respected and to feel like, what I'm doing, like people believe in it.
Oh, and you're a woman too, even better.
Yeah, even better.
So what's ahead in terms of women's wellness? I mean, where do you see this going in 3 to 5 years? Are there different things you think we'll be studying or looking at when we evaluate women's health?
I do, yeah, and especially in the realm of hormone replacement therapy. Like I said earlier, I think it gets a bad reputation just because of the research showing, all the side effects and crazy things that come with synthetics. And now we're understanding that that's not the case actually when it comes to true bioidentical. So I really think that's on the horizon, and it's going to be something that we discuss a lot more in the future.
Mm-hmm. How about you, Judy? What do you see as the future for women's health and wellness?
I totally agree with Dr. Habashy on the compounding pharmacy and the hormonal health. Also mindfulness. These tracks that they put together, and there's a team that's working with Dr. Habashy, is getting into where we are emotionally through these different stages of life. And a lot of that does tie into the metabolic health and the bioidentical hormones, but even, in our conscious conception, when a woman goes through the childbearing age, and we have a person here that really understands maybe when there's a disconnect sometimes through that process. So I think just having a resource, I want to be known that we are here for women, no matter where you're at, what stage, and we're here to listen. And hopefully we have a solution, or we can answer some of the questions they have. Because I think a lot of times we hold it in because we're a little embarrassed to talk about it. Mm-hmm. Is this normal? And just to have a place that you can share your concerns or what you're experiencing. I really want this to be a resource for women just to help them through that journey. And sometimes we don't have all the answers, but we're always researching. And I think as Dr. Habashy talked about, Dr. Carly Powell, there's an area that we focus on even on genetics, which is really powerful, but she gets into a lot of areas where gut health, mold. So we also get into some areas where you've kind of gone from doctor to doctor to doctor, and she can really help them get back on that path. And then Dr. Habashy gets them into a maintenance mode. So we're hoping we can be a resource, at least a listening ear or a referral. Maybe there's a referral in their area that we can help them with.
Well, I'm looking forward to women's wellness retreats, which I think would be so fun to have those at your property.
Well, that's a given. I mean, we will definitely have that. Yes, because I think just sharing your stories and being together, women, we do well, together and sharing stories and supporting each other. So we just started our wellness retreat, the first one this weekend. And so you'll be seeing more focused on women, but also on executives. And we have to realize we have our men in our life too. So we're looking at the whole person, but the women really, as you mentioned earlier, is once we get them engaged, then a lot of time their significant other follows them because they're feeling better. They look at the whole family unit. They start making changes there. So they want to make their lives of their family healthy as well.
Well, it's one patient at a time, right? I mean, somebody feels well and they have a positive story. Like, look what you did, Judy, with your story. I mean, back at a time when allopathic medicine was not a thing at all. And yet you stuck with that vision for 35 years until you built Strata?
Definitely. And I want to talk about a little bit of a project because Dr. Habashy is leading this with Dr. Barber. We are building, and we're excited about this because we're building a captive model on the insurance side. So we're partnering with a brokerage firm on how we blend the allopathic and Eastern medicine together in a delivery out to the community through employers. So, as we talked about earlier, is a lot of times people are not introduced to another type of medicine and they use their insurance benefits to dictate that because we are usually private paid. Mm-hmm. So they want to see, we have underwriters and actuaries looking at if we start introducing more of a Eastern medicine approach, can we be more proactive to lower health risk factors and also change people's lives? So we will start a captive next January. And so Dr. Habashy is working with a lot of allopathic doctors on educating them because a lot of them don't even know what naturopath is, what acupuncture is, energy healing. So we're going through that education process. And I think that's really powerful to really launch this out in our community in a captive way to employers. So we're very excited about that.
That sounds fascinating. So you can enroll in it and be part of a community that's working towards the health of everyone involved, right?
Yes, it is. Yes, it's very powerful.
Well, if we can get all the women healthy and feeling good, and they're responsible for 85% of the spending, just think what will happen to the economy. We'll be doing great.
We will be doing fabulous.
Do you have any, in closing, any advice for people listening who are probably operating spas or wellness centers and want to get involved with a bigger focus on women? What's a good way to get started, even at your local level? Even if you just have a spa and you're not medical, what can you do that's women driven?
One thing that we've seen is healing touch. I was not aware of this, but when a person is diagnosed with cancer, a lot of times they can't go to the spa because they're really worried about the lymphatic system, et cetera. Right. And you've heard this before. So I think just being aware of just the power of touch and getting the staff trained on that, on how to make a person just feel loved and connected. We see that it's so powerful up in our spa. And I think once you start down that path, then you will start adding additional therapies just to really grow on that. So I would just start on just the power of touch, listening, adding therapies just to really get the woman just relaxed and feeling powerful or just feeling loved is more than anything. So
it's funny. I think any spa therapist listening would say, oh, we do that. I mean, because, when you're a spa provider, esthetician, massage, nail tech, whatever. I mean, look what we tell our hairdressers, right? So you become a sort of therapist, even though you're not trained in that realm. You do hear a lot of things from clients. And if we can do our part to educate our providers on the options, we'll really make progress because they have the ear of their consumer.
They really do. They really do. So I think it's powerful. You want to add to that, Dr. Habashy?
Yeah, I just wanted to reiterate that power of connection and how imperative it is to provide, a safe environment where we can all just come together and discuss things. And I find just in my own practice that sometimes the initial intake can be therapeutic in and of itself, holding a safe space where, a woman can come and talk to you about things that she maybe had never shared with anybody else. So even just that, getting together, once a month or something and just kind of discussing things that we're going through, I think it's very, very powerful.
Well, there's power in community for sure. And we know that when we gather and share, we unburden ourselves and we all feel better and we all learn something. So I think you're all on the right path and it's an amazing path. Thank you again for joining us. Judy Mackey, brainchild behind StrataWell and StrataMed and StrataFit and owner of Garden of the Gods Resort Spa and Club. I think I said it backwards. And Dr. Habashy joining us today. Thank you so much for your contributions and for the great work that you're doing. Please keep it up.
Thank you, Lisa.